Good day, everyone. I'm Andri from Indonesia. I am a psychiatrist and a lecturer of Department of Psychiatry in Krida Wacana Christian University in Jakarta. I would like to thank to the IA4 for inviting me to the 5th Asian Conference on Education. Today, I will like to present my work in Indonesia regarding the developing psychosomatic workshop module for medical doctors in Indonesia. And this is my presentations. So this is a picture of me with the participants in the Congress of Psychoneuroimmunology, which held in Surakarta in Central Java. And the workshop was first conducted during the Psychoneuroimmunology National Congress on December 1st, 2017 in Surakarta, Central Java, Indonesia. The participants included psychiatrists, psychiatric residents, and general practitioners with a total of 40 participants. And another workshop was held during the CLP National Workshop Meeting in Magelang, Central Java in 2018. But because of the COVID-19 pandemic, the workshop was temporarily suspended for 3 years and resumed in June 2022 back to hometown Surakarta, Central Java. So the workshop objectives is to enhance understanding, improve assessment skills, and explore treatment strategies. So I would like to share with you a module that comprehend all the 3 aspects of these objectives. So with the understanding of psychosomatic medicines, this module provides in-depth understanding of psychiatric medicines regarding the psychosomatic medicines, especially to indicate relationship between mental and physical health. The participant will delve into the psychosomatic phenomenon, especially in clinical practice, examining its historical context, theoretical foundations, and practical applications in contemporary healthcare setting. And I hope through a multidisciplinary approach, this module equips learners with the knowledge and skills to recognize, evaluate, and manage psychosomatic disorders effectively. So the module outline, the first is the introduction to psychosomatic medicines. We will talk about the definition and scope, the historical evolution, and the psychosocial model, especially with the biopsychosocial model introduced by many physicians related to psychosomatic medicines, and George Engel as the first physicians that introduced this model in the medicines. The second is the psychosomatic disorder itself, the classifications and diagnosis. We know that because of the limitations of time, we focus on the problems related to somatizations, illness, anxiety disorder, conversion, and pain disorders. These are disorders that are frequently seen in our practice as a physical problems, but unfortunately, sometimes we don't know exactly that this is related or the root cause is in psychological problems. We also want to know that the mind and body connections, and I hope the participant will have some neurobiological understanding. So we have to stress these neurobiological aspects and psychoneuroimmunology to the participants, and so they can understand that the stress and its impact on health, especially when the physical symptoms of complaints come first in their hands. So also the treatment approach in psychosomatic medicines will be related to the cognitive behavior therapy, the mindfulness-based intervention, the pharmacotherapy, which is my expertise in this field of psychosomatic medicines, and also the integrative medicines, because we know some of the complaints has to deal with other specialists in the primary care or in the hospital-based approach. And we have to stress and to know that many physicians in clinical practice, they have to deliver informations and do education to the patients with many psychosomatic problems. This is why the understanding of the psychosomatic medicines will be beneficial to the patients, also to the practitioners. So they know each other about how to deal with these symptoms, not only gaining some physical examination from other specialists, but how to stop this particular experience regarding the shopping doctors to other specialists, and can stop because they know exactly what's happening in the patients with psychosomatic problems. It is a need for practitioners as physician or specialists to know this particular skill. So also the collaborative care models, because we know some of the patients with psychosomatic problems has underlying problems like cardiovascular disease or endocrine problems. And we have to collaborate with other colleagues in the practice, in the hospital or in the primary care. We know exactly that the ethical considerations and cultural competencies will be different even in the same area, because we know that maybe like in Jakarta, in Indonesia, it will be a diverse background. So the diversity in the background will be, some of the point will be beneficial to the patients and also to the practitioners to know exactly the background of historical and also the cultural background of the patient. So we know this exactly. So the holistic approach will be delivered, and I hope that the patients will understand that the biopsychosocial model, the mind-body connections, will be understood, and also by the practitioner, also in the collaborative care, because we know that it is exactly what will be beneficial and also what will be a good approach when dealing with psychosomatic problems. Unveiling the complexities, we know that this is the diverse spectrum of disorder. In the previous presentations, we delivered that some of the disorders that related to the psychosomatic problems is somatizations, pain disorder, conversion disorder, or hypochondriasis, or illness anxiety disorder. But other hand, there will be depressions and also anxiety disorders that relate the complexities of the problems itself. So we have to explore the intriguing range of psychosomatic disorder, their clinical presentations, and underlying psychological mechanism. So this module will stress in how the participants as a physician in the primary care or in the hospital will explore this phenomenon and know exactly what will do the next step to dealing with the patients with psychosomatic problems. So the analyze real cares studies, the case report from the myself, from also the participants, will deepen the understanding of the complexities and challenging in diagnosis and treating of psychosomatic problems. So I, as a instructor in this module, will give some of the case reports from my clinic, and they will discuss, the participant will discuss. And in the QA sessions, the participants will also ask me freely about their case in the clinical problems in their hospital. So there will be an interactive question and answer, interactive modules that will be beneficial for us to understand more about how to deal with the case studies that will be very specific to the patients and also for the physician itself. So the comprehensive assessment strategies in the module will be the patient interview, because we know that a good diagnosis, the appropriate diagnosis, will be beneficial to understand this background of psychological problems and also the physical problems of itself. So we don't have to agree about some of the ideas that may be delivered to the patient, that maybe because of the background of the historical or culture background, that they know this is on your head problems. But I think as a physician and as a participants of this module and its workshop, we know that the psychological assessments and the physical examinations will be very important to know that the mind and body connections of the problems of the psychosomatic problems. And also we know that the collaboration with specialists and other specialists related to the metabolic endocrine problems or the cardiovascular disease that can be related to the psychosomatic problems that the patients have now. So I think it will be a good approach when we know that as physicians, we don't have to rely on only in the one aspect, but we have to get the ideas from many aspects of approaching the patients with psychosomatic problems. Even we know that the psychological problems will be the main ideas in patients with psychosomatic problems. So the cognitive behavioral therapy and the mindfulness meditations and relaxation techniques maybe is one of the approach that many physicians will deliver in their patients. But we know that some of the problems is related to the anxiety and depressive symptoms. So we know that the antidepressants and also the benzodiazepine in the early treatments are crucial for most of the patients with psychosomatic problems. In recent studies, we know that benzodiazepines still be useful with the patients with somatic problems. And we know that psychosomatic disorder has some physical symptoms that can be beneficial if we use benzodiazepine in the early treatment. The feedback and the obstacles that we have from the workshop, the majority of the participants express the need for additional workshop focused on psychosomatic medicines to enhance their effectiveness as medical doctors in both primary and specialist care settings. They want to have a regular and updated workshop in the future. And over 70 of participants found the workshops to be well delivered, allowing them to successfully comprehend and implement the module. And they impressed with the case studies that I delivered because it seems to be realistic and represents their needs for the practical practice in daily activities as a physician. More than 50% of participants reported working within the framework of the government's universal national care coverage system. And that's why this system imposed limitations on the medications prescribed for patients with psychosomatic problems. We know that this is the problems when we're dealing with the psychosomatic problems, and the psychotherapy approach sometimes cannot be delivered because the limitations of time. Patients need more than 30 minutes if we use a psychotherapy approach, but the doctors itself only has some 15 minutes most maximal in how to deal with the patients and also how to deal with the psychosomatic problems. So it will be limitations, and it will be the obstacle for delivering the good service of the healthcare in the primary care for the patients. So the conclusions and takeaways is this module or workshop embrace the essential work role of psychosomatic medicines plays in comprehensive patient care. And we know that apply effective assessment strategies to diagnosis and manage psychosomatic condition will be delivered and will be beneficial to the patients with psychosomatic problem. Implement evidence-based interventions, because we know that some of the patients still believe that this is not a real problems, but in the other hand, they work very much to know or to find the solutions for these problems. So it will be jeopardize the techniques of intervention. But I think when we back to the evidence-based interventions, there will be the answer for the good standing of clinical approach in our primary care and also in our hospital. So this module also promote interdisciplinary collaborations to support patients with psychosomatic disorders. I think that's the presentations, and I hope that you will find the beneficial of the psychosomatics workshop module that I bring to you, and I hope I will be delivered these also presentations to get more attention with the psychosomatic problems in our society, because in the modern era like this, and we know that problems in psychosomatic problems related to anxiety and these depressive problems is also crucial to understand, and also how to deal with the evidence-based interventions and updated treatments will be beneficial to the patients and to the physicians as well. Thank you very much for the opportunity, and I hope you all good luck. Thank you.